Welcome to Dimensional Wellness 365, episode 19, Zhangyi Public Communicator, episode 225. You've noticed lately that my videos, I'm kind of forming both of them together here. And the reason why I'm doing that is I'm still going to be a focus on health, right? And health and longevity and everything healthy that comes with life. But there's a causation to a lot of these things. And, whether it's political, whether it's public, whether it's bureaucracy, red tape, individualized causation, there's a causation. This is why I kind of amalgamated both of these topics together when I'm growing forward here. And I want to start today by giving kudos to the private industry networks, right? When I look at tackling true health, those that have tackled true health, I'm going to give kudos to the private industry networks. And I'm not saying the public medical system hasn't done so, but it's been my experience that it's extremely individualized and kind of off-ed type conversations, right? One-liners and those kind of things. At no given time did somebody in the public system actually sat down and talked about true health, talked about what I know today, right? And I've talked about this before, where in 2017, my experience of traveling across this country and working with veterans and cannabinoid therapy and all that, to my research that I started doing in 2018 from a lot of the key things that were in here throughout life and how I used to be back in 1998, running marathons, use of force instructor, all that kind of stuff and background and disciplines that I had, and I was 222 and I had abs. I know that I wasn't internally healthy, right? And it's because of these private healthcare individuals that I started listening to, that they based themselves on government data. An individual a long time ago told me that government has no money, that all the money comes from the people, right? So when you look at government data and government funded data by the people, okay, the money always comes from the people. We pay for these things. So I'm going to get into it and I'm going to explain to you why I'm talking about the money and tied into health, right? Skinny fat, fit fat, TOFI. TOFI stands for thin on the outside, fat on the inside. Dirty vegans. Dirty vegan is basically individuals that they don't consume anything alive. They used to be alive, I should say, but they will eat a lot of process. That guy that I talked about, 222, running, there was a lot of process in his life, right? So they're dirty vegans because internally the visceral fats and all that stuff, it's not healthy. Obesity, obese, morbidly obese, right? Or just damn unhealthy. Let's just categorize it, because there's individuals out there, they look amazing, die at 35 with a heart attack because they were either TOFI or dirty vegans or fit fat or skinny fats, etc., right? Just damn unhealthy. There's a spectrum, there's a scale here, just call it damn unhealthy. If you start measuring metabolically healthy, right? So let's get back into this. Lifestyle born, right? I've talked about this before, where the lifestyle born is what you consume and what you expose yourself to, compared to the lifestyle changes. If you know what you're consuming, what you're exposing yourself to is unhealthy, you start making changes, okay? So lifestyle born versus lifestyle changes. The cost on the system doesn't make sense, which I talked about before. The data and research, the World Health Organization's data and research, and again, beyond the World Health Organization, the government data, the government research, the government funded, right? Whether it's an organization, a branch of, it's a branch of a branch of, it was funded by the government, it came from us, okay? So the data says that 80% of chronic illnesses and 40% of cancers, which I talked about before, would disappear and dissipate. The primarily reasons people take up hospital beds, it's because of lifestyle born, with the consumer, what they expose themselves to, chronic illnesses and blah, 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 right? The circle, constant circle, right? Doesn't add up. So when you look at the cause in the system, if a dam is breached and it's leaking, they fix the dam, they fix the breach, right? If a business sees something is burning money, they stop it, they arrest it, the damage is done, and sometimes things happen. But when you have 20 years of data, plus, or telling you that it's lifestyle born and you do nothing about it, but yet you're managing our money, you're managing our healthcare money. Remember, you have no money. The money comes from the people. It's like hiring a contractor to do a job right? You're managing our money to managing the healthcare system that's not working, but it's just continuously moving money through the healthcare system. It doesn't add up. It doesn't make sense, right? There's individuals in the private industry that I follow, that I talked about, whether it's the audio books, whether it's their website, whether it's their podcast, whether it's their literature, etc. On top of all the government data, government research, all that stuff that I talk about, the science data and research, those individuals, comments like, I'm talking about epidemiologists, I'm talking about heart surgeons, I'm talking about all those individuals in the professional field that took on lifestyle medicine. Okay? Comments like, am I going to continue to keep my head in the sand and make money? Or am I going to pull my head out of the sand and start helping people? Right? Comments like, am I going to continue removing limbs? Right? These are doctors in their podcasts not talking openly now. Say, was I going to continue removing limbs and get more medication? Or am I actually going to help people? And that's the commonalities globally. Whether I'm listening to a podcast from Australia, a podcast from the United States, a podcast from Canada, I'm talking on doctors, like people with 25, 30 years background, that kind of stuff, that went to lifestyle medicine and started teaching true health, right? Those individuals, and they're basing themselves on hundreds of thousands of files where they reverse illnesses, they reverse diabetes, they reverse cardiovascular disease, they reverse medication, they reverse all that. And they're basing themselves on data and research also. They're basing themselves on the science. Okay? And this is where it doesn't add up, because the people that are funding it, paid for by us, are not following their own data and research. But yet, private industry individuals are following that data and research, and they're changing people's lives. And here's the kicker. One of the number one causations of obesity, they say, is marketing. Okay? They know this from the research that is paid for by us, that one of the leading causes of obesity, which is part of the unhealthiness group up here, is, and actually all this, right? Your TOFIs, your dirty vegans, your fit fat, your skinny fat, all tied to processed unhealthy foods, right? People don't eat real food, right? So they know this from the data and research, from their own data paid for by us, that all this can be changed with lifestyle changes. They know this. So what if they marketed that? What if communities started marketing healthiness? What if the system started marketing healthiness? They do. Some of them do. Communities. The commonality we talked about before, your blue zone groups, right? It doesn't matter the culture, the religion, the background, the ethnicity. It doesn't matter, right? There's groups out there that teach this, and I've talked about this before, like Seventh-day Adventists. It's part of their lesson plans almost, right? They teach it to their youth. Now, do they all follow the letter of the law? Law enforcement don't even follow all the letters of the law as they are written, right? They do speed, right? Just like people don't follow the Bible, people don't follow their Quran as it is written, right? They fluctuate. So what if we adhere to key components as how they are written? That's what they are teaching. That's why they are getting lifestyle changes. People that follow it. Communities are teaching it. That's why they don't have the illnesses that we do. That's why they don't have the diseases that we do. But what if we taught it, just like they did, just as it is written, right? And we combined it with conventional medicines, your MRIs, your blood work, your urine work, your feces work, all that stuff. What if you live a primarily plant-based, healthy, fasting, fitness, and flexibility lifestyle, combined it with conventional medicine? That would work, wouldn't it? So I give kudos to the private healthcare industry, right, for managing this for us, for tackling on true health. And I give a big, like a failing grade to the governance that know that the dam is freaking bleeding out money like crazy, and you don't even follow your own data that is paid for by us. Jean-Guy Bourguignon, thank you, merci, gracias, grazie.